Welcome to our training session on home maintenance management. Common risks and safety tips for different age groups. Infants, 0 to 1 year, risks, suffocation, choking, falls, head injuries, shaken baby syndrome, poisoning. Safety tips: place babies on their back to sleep on a firm crib mattress, no soft bedding/toys. Use a crib with slats equal or lower than 2/3 inches wide, away from windows. Supervise bath time, use non-slip mats. Secure home, outlet covers, cabinet locks, safety gates, anchored furniture. Keep hazardous items, cords, and small objects out of reach. Hold babies upright for feeding, avoid choking hazards. Children, 1 to 12 years, risks, falls, burns, poisoning, drowning, sports injuries in middle childhood. Safety tips: anchor furniture, use stove guards, store toxins in locked cabinets. Eliminate standing water. Supervise near water. Provide helmets and protective gear for active play. Use proper car seats based on age and size. Adolescents, 13 and older, risks, electrical hazards, fires, poisoning, substance use, sharp object injuries, poor ventilation, domestic violence, digital addiction. Safety tips: regular maintenance for electrical safety. Fire drills, working smoke alarms. Secure and label toxic items. Educate on substance risks, provide support. Safe storage and proper use of cutting tools. Improve air quality, ban smoking indoors. Encourage communication and support for domestic issues. Use parental controls and promote internet safety. Cleaning and organization. Ventilation and air quality, ensure good airflow to reduce mold and allergens. Pest control, regularly inspect for pests that may carry allergens or diseases. Safe sleeping environment, use non-toxic, hypoallergenic materials and avoid soft bedding in cribs. Child-safe cleaning, use non-toxic, eco-friendly cleaning products, e.g., vinegar, baking soda, mild soap. Handwashing, encourage frequent handwashing, especially after using the bathroom or touching shared surfaces. Sanitizing toys and equipment, regularly disinfect toys, high chairs, and cribs with safe products. Laundering, wash bedding, towels, and children's clothes regularly to reduce allergens and bacteria. Medication and equipment management. Medication routine: maintain a daily medication schedule. Use apps or alarms for reminders. Store medications securely, out of children's reach. Use pill boxes to prevent missed doses. Correct dosage and administration: follow the doctor's instructions precisely. Safe disposal: properly discard expired or unused medications. Equipment checkups and emergency prep: regularly inspect medical devices. Keep emergency contacts and medical info accessible. Safe storage. Store medical equipment securely for quick access. Food safety and nutrition. Safe meal preparation: prepare meals considering allergies, diabetes, and dietary needs. Proper food storage: store perishable items correctly, refrigerating within 2 hours. Regularly check expiration dates and label items properly. Safe food handling and preparation: maintain hygiene, wash hands, clean utensils, and sanitize surfaces. Cook food to safe temperatures. Test formula warmth by shaking the bottle and checking on your wrist it should be lukewarm, not hot. Hydration: monitor water intake and prioritize water over sugary drinks. Allergen management: identify and label allergens to prevent exposure. Meal planning and variety: provide balanced meals with proteins, vegetables, and healthy fats. Encourage nutritious snacks like fruits and yogurt. Avoid microwaving baby formula. Maintaining clean and comfortable living spaces. Regular cleaning routine. Regular cleaning helps reduce dust, allergens, and bacteria in the home, ensuring a healthier living environment for adolescents. It also prevents accidents, such as slips or falls, caused by clutter. Safe and comfortable sleep areas. A safe and comfortable sleep environment is essential for adolescents' physical and mental health. Proper bedding, a supportive mattress, and a quiet, cool room promote better sleep quality and overall well-being. Organizing and decluttering. Keeping the home organized and free of clutter reduces stress and prevents accidents, such as tripping over scattered items. A tidy space also encourages better focus and productivity, especially for schoolwork. Temperature and air quality. Maintaining a comfortable room temperature and good air quality is critical for an adolescent's health. Poor air quality or extreme temperatures can affect sleep, concentration, and overall comfort. Handling household systems and appliances. Regular appliance maintenance. Check and maintain appliances. Ensure that household appliances, e.g., fridge, washing machine, stove, are functioning properly. Clean filters, inspect for wear, and repair any issues promptly. Safety checks. Regularly check for safety hazards, such as gas leaks, electrical problems, or faulty wiring. Child-safe appliance use. Keep appliances out of reach. Store hazardous appliances, e.g., sharp objects. Hot tools in child-proof cabinets or high shelves. Educate on safe usage. It is important to ensure that all family members or caregivers are well informed about the safe use of household appliances, especially those that may pose a risk to children and adolescents. Monitoring household systems. Heating and cooling systems. Regularly inspect HVAC systems for proper functioning and replace filters to ensure clean air circulation. Water supply and plumbing. Check for leaks. Ensure water heaters are set at safe temperatures, below 120 degrees Fahrenheit/49 degrees Celsius, and regularly inspect plumbing for any blockages or issues. Managing personal hygiene and care. Consistent hand hygiene. Regular hand washing. Ensure both caregivers and children wash hands frequently, especially before meals, after using the bathroom, and after outdoor activities. Use of sanitizers. When soap and water aren't available, use alcohol-based hand sanitizers to reduce the spread of germs. Proper cleaning and grooming. Daily grooming routine. Ensure children are bathed regularly, with attention to areas like the scalp, nails, and teeth. Brush teeth at least twice a day. Personal care products. Use safe and gentle hygiene products suited for children's sensitive skin and hair. Managing illness and hygiene during sickness. Sick care protocol. Maintain strict hygiene when caring for sick children. Dispose of tissues properly, disinfect frequently touched surfaces, and encourage the child to cover their mouth when coughing or sneezing. Isolation and rest. Ensure the child rests in a separate area if possible to prevent the spread of illness to other family members. Emergency preparedness and response. Emergency procedures. Contact a healthcare professional immediately. Document the error and the actions taken. Keep emergency contact numbers handy. Documentation and communication. Maintaining accurate records. Document health and care details. Keep detailed records of children's medical needs, daily routines, medications, allergies, and any changes in health status. Track appointments and services. Record doctor's appointments, therapy sessions, and any household maintenance services performed, e.g., repairs, cleaning schedules. Effective communication with family and professionals. Clear communication with family. Regularly update family members on the child's well-being, care needs, and any incidents. Ensure everyone involved in the care is informed. Coordination with healthcare providers. Maintain open communication with doctors, specialists, and caregivers, sharing relevant updates or concerns about the child's health and progress. Ongoing support and resources. Access to support networks, professional support, stay connected with healthcare professionals, pediatric specialists, and social workers for guidance and assistance. Peer support groups, engage with other caregivers through online forums or local groups to share experiences and support. Continuing education and training, stay informed, enhance caregiving skills by attending training sessions on child development, healthcare, first aid, and safety. Utilize resources, use books, websites, and online courses to gain valuable knowledge on pediatric care and effective caregiving practices. Thank you for watching the Home Maintenance Management module. Please answer the questions for this training before moving on to the next training module.